What do you do if you know you have parasites? How do you handle it? This is Dr. Cohn in the North Dallas area, North Texas area, talking about different health conditions and health problems and different ways of working on them. So let's say you've had some tests run, you've had some problems with your health, you had some tests run, and your doctor was able to identify, hey, there's some parasites present. What do you do about it? There's 3 different things that can be done. The first one is to take some vitamins or minerals that strengthen the immune system, that strengthen the gut, that strengthen your body. So this is a very helpful thing, and it should be done more. It's not done enough. The second and most common thing that any doctor would be thinking about would be, oh, well, let's take a medicine that, an herb or a prescription drug, something that would kill this thing. Let's take some stuff that will knock it out and kill it out. Straightforward approach. Number 3 is you can greatly benefit your body's recovery ability by reducing the foods that you know you're allergic to or that you might have a sensitivity to. If your intestines are irritated from this infection, it would benefit to not be eating foods that are really hard on your stomach. So those would be foods that you're allergic to. So if you can identify what foods also may be complicating this, back off those foods while you're working on it, you will give yourself so much faster recovery time because the load is lightened. Your body may be carrying a really heavy load with an inflammatory response and trying to be handling these reactions to foods. So if you can get off those foods, it can be very, very helpful towards speeding recovery. So vitamins and minerals, vitamin A, vitamin D, and actually vitamin A, vitamin D, maybe K. Those are some that really seem to strengthen the immune system. So those can be screened for to see if you are deficient, and if you are, take some extra. So those are some things that can strengthen the immune system, among other things. So those are just ones that are coming to mind. Prescription drugs, medical doctor would reach for a prescription drug. I wanted to mention that an antibiotic implies that it's for bacteria. Generally, parasites don't react very well, seem to be not very bothered by things that are targeting bacteria, because parasites are not bacteria. So it has to be a prescription drug that's targeting parasites. So there's various herbs out there that target parasites. Indigenous peoples around the world have known of certain plants, certain herbs that tend to clean out these infections. So there's a good history of herbs and plants that can target these things too. So you could choose some, or your doctor of choice could be using some of these natural remedies towards assisting with this project. And then if you're having some food sensitivities, you need to identify what foods you're sensitive to or allergic to and back off those. So you would run a good food allergy panel too. You can do that with a blood test. You can do that with applied kinesiology testing and identify what foods your body is having trouble with. Back off those foods while you're working on this project. Another thing I wanted to mention, the larger parasites are egg layers. The smaller parasites, just under that umbrella term parasite, they may be one-celled organisms. A one-cell organism is not going to lay an egg, because an egg, is a complicated thing. Single-cell organisms are just going to divide. But the larger ones, the worms, are large enough to lay the eggs. And it seems like eggs are hard to kill. So with your doctor of choice working on parasites, they need to understand, and probably do, that the larger parasites, if they have an egg-laying ability, that the therapy needs to be quite a long time. Generally, to get over a cold, you can get over a cold in about a week, maybe 2. Yeast infection, you might be able to knock out a yeast infection in 2 weeks or so. But if someone has large parasites and there might be some eggs involved, and this is probably like a 3-month project minimum, you're going to start feeling better quickly. You're going to start feeling better within a few weeks because most of the mischief is coming from the adults. But you don't want to then stop and have some egg that was hiding and not being killed hatch, and then here comes another wave of troublemakers and it comes back. So you have to stay on a schedule until there is no possible chance of any egg being left that can come out. So you usually will start feeling better within a few weeks, but the therapy must continue because of the fact that there might be some eggs. Parasites particularly the larger parasites, are one of the hardest things, not hardest, but it's one of the longest things to treat. Just wanted to mention that for you. Have hope, don't be discouraged, but be patient. Once you identify what it is and you're working on it, be patient, because it needs to be something where it just needs to make sure that this is, handled and done. Another little tidbit is I wanted to mention that sometimes it's hard to get rid of a particular infection, parasite infection, if someone else in the family has the same infection. So it is not uncommon, not unheard of, for one person to just be feeling miserable and having a lot of complaints with their body, stomach problems, tired, and another person has the same infection, but they don't seem to have any problems. They may be just kind of a carrier for it. And that person who's very sick may have trouble getting better if that other person is still going to have it present. So usually this is like a spouse or significant other. So if it seems like, wow, there's some weird stuff, why does this keep coming back? You might want to have your significant other get tested too. That can be one of the things that solves a tough case. Just wanted to mention that. Hope this has been interesting for you. Hope you guys are doing well, staying safe, staying happy. If you enjoyed the video and found it enlightening, please like it, ask me questions. I'll do my best to answer any questions. And subscribe. That would mean a lot to me. I'm trying to grow this channel. So subscribe, let's grow, and share the news with the world about some of the things